Have you ever wondered what it's like to work as a medical laboratory technician? I'm Elizabeth. Today we're spending time with a Carrington College graduate to find out what a typical day is like at St. Luke's Medical Center.
My name's Chad and I'm a medical laboratory technician here at St. Luke's Medical Center. And microbiology is very important. I've been here for about a year and a half. I worked my first year as a phlebotomist while I was finishing school at Carrington. I graduated in April of 2016.
My name's Kevin. I'm the microbiology lead at St. Luke's Medical Center. I run the microbiology department. We isolate and identify disease-causing pathogens and confer with physicians as to the best course of treatment. Other departments are more crucial to blood counts, white counts, what's going on at that minute in the patient. We're more helping the infectious disease physicians treat the patients.
When we get here first thing in the morning, we collect all the specimens that have shown up overnight from the other hospitals that we do micro with. And we set up everything, we plate all the specimens. The media that we use, anything can grow in it, so you have to be very careful with what touches the media.
You have to know the basics. You have to know, for micro specifically, what staph should look like, what Pseudomonas should look like, and then you should know the accompanying biochemical tests that each of them should have. You should know what drugs are used to treat what type of infection.
With the microscope, we're mainly just looking for whether it's a gram-positive bacteria or a gram-negative bacteria. Well, your basic strep and staph species are gram-positive, and your E. coli is an example of a gram-negative bacteria.
The microscopes are used for gram-staining direct samples to check culture growth on plates if you need to confirm what you're seeing on the slide versus what you're seeing on the plate. It's used throughout the day. It's a big part of the process. I like working with Carrington College graduates because they have the critical thinking skills and they've got a solid foundation that they've learned in the classroom. I'm looking for critical thinkers. I'm looking for somebody that can bridge the gap between what they've taught in class and what they've learned out of books and how to apply it actually in the real world.
A lot of our instructors at Carrington, they bring them in from hospital settings. They're already MLTs or MTs, and they give us a lot of hands-on information that they've done while they were out there in the job.
A big part of Chad's training at Carrington was getting to know the basics. And then when he gets here, he's not just reading it out of a book, he's applying it. And repetition over and over and over just ingrains it in your mind.
So what are you waiting for? To learn more about the Medical Laboratory Technician program at Carrington College, visit carrington.edu today. Carrington College, the starting point for healthcare careers.